Today I would like to impress upon the people of India the importance of heart disease and the burden of heart disease that we are facing in our country. Now, India has become the leader in heart diseases throughout the globe. So, these heart diseases in Indians are tending to be something called premature heart disease. That means that heart disease, when it starts less than 45 years for males and less than 55 years for females, this is called premature heart disease. In the globe, whereas this number or the percentage of patients with premature coronary artery disease is 5%, in Indians that number is as high as 12 to 16%. So Indians are more prone to heart disease at a younger age. There are some silent killers which are very common in India, that is diabetes and hypertension. So high blood pressure is as high as 25% in urban areas and 15% in rural areas in India. And diabetes is ranging between 10 to 20% amongst adults in India. So these values, these numbers are just the tip of the iceberg. There are so many patients who are undiagnosed, who are not diagnosed early enough, who are facing this epidemic of blood pressure and diabetes. Now, when people are diagnosed with blood pressure and diabetes, additionally they have risk factors like smoking, lack of physical activity, being overweight, stress. Who can avoid stress in today's day and age? So all these additional risk factors add to our burden or our risk of developing heart attacks and coronary artery disease. Now, coronary artery disease basically is a heart blockage or a cholesterol blockage which develops in our coronary arteries. That is the arteries which give blood flow to our heart. Now, when the heart faces reduction of blood flow, suddenly a person will develop symptoms. These symptoms are chest pain, chest discomfort, pain in the arm, pain in the throat, sweating profusely. When someone has complaints like this, they should immediately rush to the hospital. Unfortunately, in India, what happens is that people have these complaints. They decide or they think, oh, it's late at night, should I disturb my doctor? Or let me put some balm, let me put some Iodex, maybe my wife can give me a massage and I'll be better. So a lot of times there's a lot of delay between the time that a person starts getting symptoms and the time he reaches the hospital. This delay is sometimes as high as 5 to 6 hours in India. And the golden hour, the first hour where we can achieve maximum benefit for the patient, is unfortunately lost. This is more prevalent in females. Young women, earlier there was a concept that young women are immune to heart disease. It is unfortunately not true anymore. Younger women are also getting heart attacks. They are also prone to heart diseases because the risk factors have changed over the time. So young women, a 40-year-old lady with chest pain, first of all is more likely to neglect it, is more likely to think this is not something significant, is less likely to go to a hospital, and is therefore more likely to have a major heart attack, more complications of the heart attack. So women also need to understand that they are not immune to this risk of heart disease. Now, males and females, once they have come to the casualty, if a person has chest discomfort, then they can reach any hospital soon. The options are several. There are two major options that we offer patients with a major heart attack. First option being something called thrombolysis, which are the clot busting medicines. These medicines are given intravenously. Either they are given over an hour or an hour and a half, or they are given directly IV over a few seconds. Now these medicines are clot busters. Clot busters immediately dissolve the clot which is causing the heart attack in the coronary arteries, and it restores the blood flow immediately. This is the first option, and it seems to be a very simple option, but problem is it comes with a lot of high risk of bleeding elsewhere. It comes with only a 60% success rate, which means in 40% of people your artery will not open up completely and the heart muscle will continue to get damaged. So what is the better option? The better option is called primary angioplasty in a myocardial infarction. This primary angioplasty means that patient comes to the casualty in a matter of 60 to 90 minutes. The patient is taken immediately to the cath lab. An angiography is done. The blockage is found. The blockage is removed with sucking out the clot, and immediately a stent is put, which ensures the artery remains open and ensures that the blood flow is continuing to the heart. This is called a primary angioplasty. This is an extremely good option. It has a nearly 95 to 100% success rate, where you're ensured that the blood flow is restored to the heart. So if a younger patient comes to the hospital, they have options available. Now in India, sometimes it's not always possible to be close to a hospital which has a cath lab, which has availability of doing a primary angioplasty. So there is a third option available, which is called a pharmaco-invasive therapy. This means the patient goes to a hospital, wherever they have an ECG available, the ECG is done. If it's determined that the patient has a heart attack, the patient is given the clot-busting medicine immediately, and within 3 to 24 hours, the patient is shifted to a hospital which can do an angioplasty. And in the first 24 hours, that artery is opened up and stented, which ensures that the blood flow is restored to that heart immediately. So options are a lot, options are available. We have to ensure that our young generation is educated, made well aware of the risks of heart disease, and they are made aware that not only if they or any of their relatives get any of these symptoms, chest discomfort, breathlessness, sweating, arm pain, jaw pain, any of these symptoms, they should immediately rush to a nearby hospital, avoiding any delays in management. So it is important that we educate our young population. We ensure that they will have long-term benefits, ensure that they adhere to the lifestyle changes, and make sure that if they are prone to heart diseases, you minimize the risks and maximize the positive and the beneficial outcomes which today's science and today's facilities are capable of offering them.